The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and good morning to you if you are on the West Coast. My name is Jose Leon, Chief Medical Officer at the National Center for Health and Public Housing. I want to welcome and thank you all for attending today's webinar, Smoke-Free Public Housing, Reducing Tobacco Use Among Public Housing Residents. This webinar is being recorded and the slides and other materials will be emailed to you after the webinar has finished. You can also download the slides, which are available in the handout section of your control panel. At the end of the webinar, we will have a question and answer session. I would like to say thank you to HRSA for allowing us to make this webinar possible through a publication grant. And I'd like to get started and introduce our speakers for today's webinar. Our first speaker is Ms. Marie Nichols Dixon. She has over 30 years of experience managing and evaluating housing and community development programs in HUD and with the U.S. General Accounting Office, GAO. She currently serves as the Director of the Office of Policy Program and Legislative Initiatives, OPPLI. In her role, she is the primary advisor to the Deputy Assistant Secretary of OPPLI on policy formulation and assessment of the Office of Public and Indian Housing PIH programs. Marie has directed and shaped the policy for many key programs within HUD, such as the smoke-free policy, Jobs Plus, paperwork reduction process, and various efforts to streamline and regulate low-income housing programs. She managed the review and comment of all PIH notices and rules pertaining to public housing, Section 8, Native Americans, and the Real Estate Assessment Center. Ms. Nichols Dixon spent over 14 years as a senior program evaluator at the GAO. During her tenure at GAO, she led economy and efficiency reviews of community development, homeless assistance, and public housing programs. Known throughout her career for her analytical and communication skills, Ms. Nichols Dixon has received numerous awards for outstanding achievements. Ms. Nichols Dixon holds a master's degree in urban studies from University of Texas at Arlington. She has received extensive training in program evaluation, project planning, facilitation, team building, alternative dispute resolution, and coaching. Without further ado, I will turn it over to Marie. Good afternoon, Marie.
Good afternoon, Jose. Thank you for the invite. Thank you to all of the listeners for joining us on this call regarding smoke-free. The first slide is just an overview of why do we need a smoke-free policy. First of all, smoke-free policies from the HUD perspective are not about where people smoke. It's not about whether they smoke, but it's about not allowing people to smoke within their unit. Many residents prefer to live in smoke-free buildings. Smoke-free policies are often used as an amenity or marketing feature and may increase occupancy rates. Secondhand smoke is a known human carcinogen. It can cause heart disease, cancer, COPD, and other lung diseases. Cost savings from maintenance, insurance savings, lower risk of fire, and reduced legal liability. Secondhand smoke flows between units through the ducts, vents, open windows, and other means, despite ventilation and air filtration. The bottom line is that there is really no safe place to smoke within a unit. And the rule is to prohibit smoking within the unit. And our goal is to help housing authorities prepare to implement the rule. So what does the rule do? The rule requires public housing agencies administering public housing to adopt the smoke-free policy by mid-2018, which is 18 months from the November 30th, 2016 effective date. The policy must prohibit the use of prohibited tobacco products in all areas, including individual living units, common areas, administrative office buildings, and outdoor areas within 25 feet of those areas. The rule covers public housing units, including scatter site and single-family property. The rule excludes dwelling units in mixed finance projects. It does not apply to housing assistance under Section 8. PHA properties that have converted to project-based rental assistance under the Rental Assistance Demonstration Program, RAD, or tribal housing. HUD continues to encourage excluded properties to voluntarily adopt smoke-free policies. Second slide, please. The rule prohibits smoking in all outdoor areas within 25 feet of the Housing and Administration office buildings or to the PHA's property boundaries in situations where the boundary is less than 25 feet. Any designated smoking areas would have to be outside of the 25-foot buffer zone. The rule does not cover outdoor areas 25 feet of housing and administrative offices. The rule has received a variety of support from health organizations and advocacy groups as well as many PHAs. We received over 1,000 comments on the rule, and the bulk of them were complimentary. Some of the concerns raised by some PHAs and other interest groups deal more precisely with implementation of the rule. But we can safely say that the bulk of the rule was supported by tenants, resident organizations, and public housing interest groups. Next page, please. As noted earlier, the rule must be fully implemented by July 30th, 2018. And what we mean by implemented is that housing authorities must have policies and procedures in place that prohibit tenants and residents from smoking within the unit. Smoking violations are handled in the same way as other lease provisions. We are recommending the graduated enforcement, escalated warnings, documentation and tenant files. Termination of assistance is the last resort. State and local requirements vary, but they are applicable. Guidance includes examples and best practices. Next page, please. Next slide. HUD and working with some of our partners, which you will hear from today, have worked to develop a host of resources and technical assistance. We have developed fact sheets, training materials, and a digital resource library. These resources are available on HUD.gov, smoke-free public housing. That concludes my overview of the public housing rule. Thank you.
Thank you, Marie. Thank you for your wonderful presentation and introduction of the HUD's rule banning smoking in public housing. Our second speaker is Simon McNabb. Simon serves as an expert on tobacco control policy. In his capacity, he has helped develop and release the last 6 Surgeon General reports, including the landmark 2014 50th anniversary report as well as those on secondhand smoke on youth tobacco use. Simon has worked in environmental health since the late 80s, working in the federal government since 1997. Simon led the EPA's secondhand smoke efforts from 1998 to 2003, helping to design their Smoke-Free Homes campaign and participating in the development of the U.S. government's secondhand smoke position during the negotiation for the Framework Convention on Tobacco Control. Simon works closely with the Office of the Surgeon General, Department of Health and Human Services, to help coordinate the department's tobacco control activities. He's one of the authors of the HHS Tobacco Control Strategic Action Plan. Simon is the designated federal official for the Interagency Committee on Smoking and Health. Good afternoon, Simon.
Good afternoon, Jose. Thank you. And let me confirm, are my slides now visible?
Just let me change the presenter, Simon. There we go.
All right, and I'll click accept. There we go. All right, good afternoon, everyone, and good morning to those of you on the West Coast. Thanks for the opportunity to meet with you on this webinar and to share information about the Tips from Former Smokers campaign, as well as to let you know about some free resources available from CDC to help smokers in your community quit and also reduce exposure to secondhand smoke, especially before and as well as the HUD smoke-free rule is being implemented. There we go. So over the past several years, the CDC has worked closely with HUD in its efforts to encourage public housing authorities to voluntarily adopt smoke-free policies. And we strongly support the new rule that went into effect earlier this year. It is a priority for CDC's Office on Smoking and Health to help implement this rule, providing all the help we can to HUD and other members of the community, such as yourselves, in supporting a successful implementation. As part of that support, we at the Office on Smoking and Health, as well as our network of states, state tobacco control programs, provide a number of methods of communication support that's noted on this slide. In my presentation today, I'd like to talk specifically about CDC's Tips from Former Smokers campaign and how we've used this campaign and its resources to encourage housing authority residents to quit smoking. Well, as you are aware, and as Marie told you, well, the rule does not require housing residents to quit smoking. It is a great opportunity to encourage smokers to quit and to educate all residents about the dangers of secondhand smoke. Promoting quitting and giving smokers resources to quit successfully can smooth the way to a successful implementation. You can use these resources that I'm going to talk about today to encourage people in your community, people either who come to the health center or are part of the community at the Public Housing Authority, to quit smoking as well. So first, I'm going to provide a brief overview of the TIPS campaign and how it has been effective in helping smokers quit. Then I'll share some ways we have used this campaign and the resources, free cessation resources, to encourage HUD's multi-unit housing audiences to quit. And finally, I will tell you about how you can access and use many of these free resources. So let's start with a brief overview of the TIPS campaign. I am hoping that those of you on the phone are aware of this. This is not the first you are hearing about this, since we've been doing it for 6 years now. It was launched in 2012 with the primary goal of helping smokers quit. It features real people living with smoking-related diseases who volunteer to tell their stories to motivate other people to start smoking, not to start smoking, excuse me, or to help smokers quit before similar health issues happen to them. Many of the people featured started smoking in their early teens, and some were diagnosed with life-changing diseases before they were age 40. 2017 marks the 6th year that this campaign has been on. And we found that this approach we found by doing research among smokers, and we found the strength in focusing on smokers living with disease as opposed to how smoking kills the people who use cigarettes, excuse me. And it's a more powerful message when smokers hear about other smokers living with the cigarette caused disease. We know that this approach works after several years, because every time we air the advertising on TV, calls to the quit line increase greatly. So if you look at this chart, it shows a strong correlation between the calls to the quit line, represented by the gray line across the page, and the media placement of the TIPS ads, represented by the colored lines, with different color for each year of the campaign. This clearly shows that every time period during which the TIP ads are on TV, calls to the quit line increase significantly. In addition to quit line call volume as an indication of success, we also have published articles on other outcomes too. For example, the 2012 campaign motivated an estimated 1.6 million smokers to make a quit attempt and about 100,000 smokers to quit for good. And as a result of the 2014 campaign, an estimated 1.8 million smokers attempted to quit smoking and 104,000 smokers quit smoking for good. In fact, since 2012, the TIPS campaign has motivated millions of Americans to try to quit and more than 500,000 cigarette smokers to quit for good. If you have any interest in reading more about the campaign results, including published papers about various aspects of its impact, you can go to the webpage www.cdc.gov/tipsimpact. I'm going to be showing you a lot of resources, and on there is a handout, a two-page handout that's available with all these links on it, so you don't need to write anything down as I am speaking. But what's most relevant to you is the current campaign. So let's talk about it. The 2017 campaign includes ads from previous years that focus on health issues caused or made worse by smoking or exposure to secondhand smoke, including the conditions on this slide. And just so you know, the ad pictured on the slide features Rebecca, a smoker who thought smoking helped her depression and anxiety, but who, when she finally was able to quit, felt better physically and emotionally. I had the privilege of meeting Rebecca and working with her on a TIPS promotion, and she's a great inspiration. The 2017 ads have been running since January and will continue to run nationally through the end of next month, through July 30th. The national placements include television, digital and social media, print ads in select magazines. Some ads will also be placed locally in some markets with high smoking prevalence on TV, radio, and including billboards. We have also developed some unique communication products in order to better reach a diverse audience, such as Spanish speakers, some Asian languages, Chinese, Korean, Vietnamese. We have targeted campaigns towards American Indians and Alaska Natives, and also lesbian, gay, bisexual, and transgender communities. Many of these populations have higher than average smoking rates, so they were priorities in our messaging, while others needed tailored communications and media placements due to language differences. So let's talk about how the TIPS campaign and its resources can help with the implementation of the HUD smoke-free rule. Free state and local cessation resources, including state quit lines, are part of the support. Through linkages with state tobacco control programs, we are able to provide support to smokers with resources including the 1-800-QUIT-NOW, which connects callers to state quit lines, 1-855-DEHELO-YA, which provides help in Spanish, the Asian Smokers Quit Line for help in Asian languages, which is Mandarin, Cantonese, Korean, and Vietnamese, as well as the National Cancer Institute's text messaging services and online quitting support website at smokefree.gov. State and local health departments are also great resources to help your groups and HUD multi-unit housing properties prepare to go smoke-free. If you haven't already made contact with the State Tobacco Control Program or your county health department, I strongly urge you to do so. Links for how you can find them are available on that resource sheet that I mentioned. We have a number of TIPS campaign resources. The main one is the TIPS campaign website at cdc.gov/tips, which includes campaign information and resources, including a I'm Ready to Quit page that provides a link to free quit smoking resources that I mentioned earlier. We also have partner pages with specific resources for healthcare professionals, including pharmacists, dental, vision, and mental health professionals, public health professionals, and a new page for organizations serving public housing residents. On these pages, you can find handouts that can be given to smoking patients, links to where you can download radio and TV ads to play in your health centers, an online interactive training on how to help smoking patients quit, notepads that you can order with reference the quit line, and information about quit lines in several languages. In March 2017, we launched a new page, the TIPS partner webpage for organizations serving public housing residents, which includes housing managers. This partner webpage contains helpful information, including resources for housing managers on going smoke-free, HUD smoke, a handout called HUD Smoke-Free Rule, what you need to know, what is secondhand smoke, how is it harmful, how does smoke-free housing benefit housing managers and protect residents, and free CDC resources for managers. And other additional resources. And with these, we've worked closely with HUD. So some of them are the same resources that Marie mentioned, and some of them are ones that we created on our own. In 2016, we undertook an effort to broaden TIPS reach that took advantage of the timing of this new rule. We know that 2/3 of smokers who want to quit and smokers who live in public housings may be especially motivated to quit when their buildings become smoke-free. We developed the materials because we want smokers to know that these are resources available to help them quit. We had multiple efforts in 2016 to reach public housing audiences, and we have additional efforts planned for 2017. These include billboards. In September of last year, we placed billboards in more than 780 locations surrounding HUD housing units. Digital video ads. In September of last year, we also placed TIPS 30-second digital video ads directly on mobile phones and devices of low SES mobile device users who live or are present in set areas surrounding HUD's physical ad placements and or areas of high tobacco prevalence. This geolocation promotion featured 5 TIPS videos ending with a call to action featuring CDC cessation resources. These ads were geo-targeted to reach the areas around HUD addresses nationwide. During the first 3 weeks, the campaign delivered over 7 million impressions to users in HUD markets. We're planning some new placements in 2017. And again, we'll try to reach all HUD locations in the nation with digital video, encouraging smokers to quit. The videos will primarily be served on mobile devices and will be geo-targeted, available within 1 mile radius of these locations. The Roosevelt ad, which you can see on the left here, Jessica, and the Cessation and Tiffany's tip ads will include links to TIPS website page. These ads will run for 9 weeks, starting July 31st and continuing through September 30th. You can see some posters here that we developed. These posters focusing on supportive cessation and secondhand smoke messages in English and Spanish. These posters focus on supportive quit smoking messages and secondhand smoke messages. These free posters are available in print in various sizes on our download center. If you want to customize these posters with your own logo instead of our CDC logo, you can contact our Media Campaign Resource Center, and they can work with you to do that for a nominal fee. Otherwise, the posters are free to print and hang on your from our TIPS download center, noted on the resource sheet. We have previously worked with community centers, health centers like yourself, WIC clinics, and other groups to place TIP posters in these settings that encourage smokers to quit, or to start a conversation about quitting smoking and let them know about free resources. We hope that you avail yourself of these and place them in similar ways so you can see on this slide. We also created a smoke-free resource flyer available in English and Spanish that encourages residents to use the new rule as an opportunity to quit smoking. This flyer highlights the dangers of secondhand smoke and the importance of protecting non-smokers, family members, friends, and neighbors. It focuses on the benefits of quitting smoking, and it also focuses on how resources can be easily accessed. In January of this year, we sent these flyers to nearly 4,000 public housing directors around the country and asked them to share them with their public housing community and print them in common areas. These flyers are available to you, and we encourage you to download them, print them, and use them in your settings. So we want to let you know about one other big resource, and that's 30 Smoke-Free Days coming soon. It's a Facebook event. So what is it? OSH, via our Facebook page, and the National Cancer Institute smokefree.gov page are partnering for 30 Smoke-Free Days, an online Facebook event for those wanting to quit smoking, but who still need to take the first step. The page will serve as a resource for people to find support and get helpful tips on how to quit smoking and stay smoke-free. So during the 30 days, participants will receive milestone badges, links to resources, tips, encouragement, and exclusive video content with advice from the Tips from Former Smokers participants. In addition, we plan to support event participants by having NCI staff answer questions and provide guidance on successful quit skills. If you're on Facebook, you can RSVP to the event starting June 26th, so later this week. Nearly 650 people participated in this event last year, and we look forward to another a successful launch of this year. And so it runs again from July 10th to August 9th, and you can sign up next week, June 26th. And feel free, if you're interested, you could promote it through if you have social media presence, Facebook, we encourage you to do that, and we encourage you to take part. So in conclusion, these are some of the ways that you can use the TIPS campaign and leverage it to promote the free resources and help people in your community quit. Our resources are very helpful. They've shown, we have evidence that shows that they work, that they successfully help people quit, driving them to the quit line or the online resources. And it helps smokers and non-smokers be educated about the risks of smoking and the risks of secondhand smoke. And they're all available for you to use, and we hope that you will use them in your settings. So here are the list of resources. You can get a PDF of these slides, but as I said, there is a handout that lists all these as well. And here's my contact information, but I will stop there, and I understand that after the next presentation, I will be available for questions. Thanks. Thanks, Jose.
Thanks, Simon. Then I would like to introduce our third speaker, Anne DiGiulio. She is the trainer of lung health policy at the American Lung Association and leads the Lung Association Tobacco Cessation Policy Project. In her capacity, Ms. DiGiulio serves as project manager for 2 federal tobacco cessation grants, one on state Medicaid tobacco cessation medication coverage, and the other technical assistance on tobacco cessation coverage in both Medicaid and private insurance. She has co-authored a state Medicaid expansion tobacco cessation coverage and number of adult smokers enrolled in expansion coverage, United States 2016, and a state Medicaid coverage for tobacco cessation treatments and barriers to coverage, United States 2014-2015. Published in December 2016 and October 2015 in the Centers for Disease Control and Prevention's Morbidity and Mortality Weekly Report. Ms. DiGiulio also provides strategic guidance and assistance to state and non-governmental tobacco control staff and policymakers. Good afternoon, Anne.
Hi, thank you so much, Jose. Can everybody hear me okay?
Yep, we can hear you.
Okay, great. So as Jose very generously introduced me, my name is Anne DiGiulio. I'm the manager of lung health policy here at the American Lung Association. And I'm here today to talk about tobacco cessation coverage specifically in terms of Medicaid. And kind of following up to what Simon had said, we know that the main goal of the smoke-free housing rule isn't for people to quit smoking, but really to prevent secondhand smoke. But based on some experiences that we've all had with properties going smoke-free voluntarily, we do know that it drives up demand for smokers to quit. And additionally, we know that a number of residents in public housing are also on Medicaid. So I'm going to talk a little bit today about what coverage is available to them. And so I'm just going to quick overview. I'm going to talk about quickly what a comprehensive cessation benefit is, what federal requirements are for Medicaid coverage, what some state requirements are for Medicaid coverage, and then some promotion of the benefits. And I'm just going to quickly qualify everything I'm going to say. The Affordable Care Act does have a really big impact on what's required for cessation benefits. And as we speak right now, the Senate is debating their bill to repeal and replace or reform healthcare in the ACA. So some of this may change, and I'll try to point that out as we go through, and I'm happy to follow up with questions during the Q&A section as well. But while all that's happening, the Affordable Care Act is still the law of the land until it isn't. So these requirements still exist, and for a lot of these populations, the requirements will still exist, at least based on what we've seen in the future. So I'm going to quickly just start by going over what a comprehensive cessation benefit is, just so we're all on the same page. In the comprehensive cessation benefit, which is defined by the Treaty on Tobacco Use and Dependence 2008 update, and this is the most recent version. It's also in the United States Preventative Services Task Force. But a comprehensive benefit is 7 medications, which are 5 NRTs or nicotine replacement therapies, and that's the gum, patch, lozenge, nasal spray, and inhaler. The gum, the patch, and the lozenge are all available over the counter. The nasal spray and the inhaler, you need a prescription for. There's generics of the gum, the patch, and the lozenge. There's also bupropion, which is also known as Zyban. Bupropion sold as a generic, as well as Zyban, which is the brand name, which needs a prescription. There's varenicline, which is only sold as the name brand Chantix. And all 7 medications are safe and effective to help smokers quit, all FDA approved. And they've all been found effective, and it's really based kind of patient history and preference should really help determine what medication a patient gets. In addition to that, a comprehensive benefit also includes 3 types of counseling. And that's going to be individual counseling, which is face-to-face, traditional, done typically with a doctor, a tobacco treatment specialist, or some other practitioner. Additionally, there's group counseling, which is frequently done as a class format. And then there's phone counseling, which Simon referenced a lot, and that's typically done through the Quit line. Evidence shows that people are most effective in quitting when they use a combination of both medications and counseling. And then the other thing just to note is that the same treatments have been shown to work in the behavioral health populations, but sometimes just needing greater dosages. And we also have some barriers that we come across quickly. Jose mentioned we collect tobacco cessation coverage data for state Medicaid programs, and these are some barriers we see frequently. So cost sharing or copays, even nominal copays can be quite large to a population that doesn't have a lot of income to begin with. Prior authorizations, needing to get that prior authorization, which might mean going back to the provider's office. Stepped care therapy, meaning you have to fail on one medication before you can try another one, which can be really frustrating and really kind of mimic and harm the desire to quit. And then required counseling. And as I just mentioned, it's more effective when people use both medication and counseling together. However, we know that making somebody go to counseling in order to get medications can be a barrier if it is because they've got a limited number of minutes on their phone, problems with childcare to get to a group class or to an individual counseling session, or just even the transportation to get there can be also a challenge and daunting. So while we would encourage everybody to have counseling along with their medications, requiring it can really be a barrier. Limiting the duration, annual limits or lifetime limits, we don't see these quite as much anymore, but they still do exist in some cases. And then dollar limits, so you can only spend $100 this year on cessation treatment. And so for a lot of people, that might not be enough. And now I'm going to quickly talk about some federal cessation requirements, and there's differences depending on which type of Medicaid people are on. And we're going to start with the traditional or the standard Medicaid plans. So these are the Medicaid plans if you're in an expansion state. These are the people that would have been, their income would have made them eligible for Medicaid prior to expansion. If you're not in an expansion state, this is everybody on Medicaid for you. And so the way Medicaid drugs work is if it's part of the drug rebate program, if the state participates in that, they've got to cover, they get reduced rates, and the states were to get their reduced rates if they cover all the drugs the manufacturer makes. However, there's a list of medications that can be excluded from that. And tobacco cessation medications used to be excludable. so states didn't have to cover them. However, Section 2502 of the Affordable Care Act removed tobacco cessation medications from that exclusion list. So that means that they couldn't be prohibited. The Lung Association likes to think that that means that they had to be covered, but not all states are necessarily implementing it that way. States do need to submit a state plan amendment in order to make sure all their medications were covered. Additionally, this doesn't address counseling, and it also doesn't address any barriers. So you're still allowed to charge, like the poorest of the poor, a copay, where you're not necessarily, as you'll see in a minute, able to charge higher income groups copays and cost sharing. In addition to the state deciding that they're going to, really truly implement Section 2502, they have to make sure it's spelled out in their managed care plans and that it's actually happening on the state level. So there's a lot of different pieces of this. But for the most part, and every Medicaid enrollee has access to at least some medication. So it really did move the needle forward. The population in Medicaid expansion, so this is going to be the population that was eligible, that would not have been eligible for Medicaid prior to expansion, up to 138% of the federal poverty level. That's just over $16,000 for an individual for an entire year, so a little bit over $1,000 a month for an individual. And then for a family of four, that's going to be almost $34,000 a year. So not very high incomes. And the federal government pays most of the cost of the Medicaid expansion. And there's various requirements that these populations were supposed to get, including the essential health benefits, which includes that preventive services. And those are supposed to be covered with no cost sharing. And the caveat, obviously, is Medicaid expansion is optional for states. So there are still 19 states that have not expanded Medicaid. And as I mentioned, tobacco cessation is part of the essential health benefits as it's a preventive service. So what's the preventive services requirement that I talked about? So one of the essential health benefits is covering any preventive service that's given an A or a B that the United States Preventative Services Task Force. Tobacco cessation is given an A rating. It includes all forms of counseling and all 7 medications, so that comprehensive benefit I talked about a couple minutes ago. And it's really kind of weird. So the USPSTF recommendations are clinical guidelines. So it's talking about what clinicians should do for their patients. It's not necessarily insurance coverage. So the Departments of Health and Human Services, Labor, and Treasury decided to release sub-regulatory guidance in the form of an FAQ, or a frequently asked question, and they released a number of them. And on May 2nd, 2014, they talked about how tobacco cessation should be implemented. And I've listed it out right here. So 4 sessions of the group of the counseling, and at least 90 days of all FDA-approved cessation medications. And that's considered one quit attempt, and an individual should get a quit attempt at least twice a year, with no cost sharing and no prior authorization. And so this FAQ kind of translates what that USPSTF recommendation said from that clinical guidelines into insurance coverage language. So that is how the Medicaid expansion plans know how to implement it. There's still a lot of implementation that needs to happen at the state level. That one MMWR that Jose referenced in my introduction showed that while, again, all states are offering at least some medications for all expansion enrollees, not all states mimic this guidance and what they're offering for enrollees. And then in September of 2015, there was an updated recommendation. That updated recommendation said that, tobacco cessation still has an A grade. Still found that both counseling and pharmacotherapy or medications are effective in helping smokers quit. And again, we're still states are responsible for implementation, which leaves some room to go, some improvement. But states are doing a pretty good job right now. And the one group that gets special treatment, in addition to all of this, is pregnant women. So there's a Section 4107 of the Affordable Care Act that's written with pretty strong language that says pregnant women on Medicaid should get a comprehensive cessation benefit, meaning all 3 forms of counseling, all pharmacotherapy, or all those 7 medications, really with no barriers. And as the USPSTF recommendation says, and I'm sure most of you know, really the decision of what medication a pregnant woman should be on should really be a decision between the doctor and the patient. And so, we just want the laws just make sure that it's available for all pregnant women on Medicaid to have. So, we all know that smoking's linked to low birth weight, premature babies, and that secondhand smoke has been linked to SIDS as well. So, just really, trying to make sure that women have every opportunity to quit. So that is another thing. Again, states still needed to submit a state plan amendment in order to make sure that this was a covered service. And now states have done their own things on tobacco cessation requirements in addition to some of the things that the federal government has done. And so here are some recent state actions. Both California and Kentucky in the past, California back in December, I believe, in Kentucky, I think a couple months ago, passed laws that require a comprehensive cessation benefit with no barriers or minimal barriers. California's required minimal barriers specifically for all of their Medicaid population. Kentucky passed a law recently that required a comprehensive benefit for any plan sold or administered in their state with no barriers. It's a very ambitious law, and we're really excited to see that implemented and really, really proud of that. And then South Carolina just announced a couple weeks ago that they are implementing a comprehensive cessation benefit for their Medicaid enrollees with no prior authorization and no copays. And they had a number of different managed care plans and a lot of varies by plan insurance coverage. So it was really nice that they're making it one benefit and making sure that that's comprehensive. In addition to some of those things, there's other things that states can do to improve cessation benefits. The private insurance market is supposed to have the same benefit as that Medicaid expansion group that I mentioned a moment ago. And there's a number of insurance commissioners that have released either insurance bulletins directly to the plans or consumer alerts. 16 states have done that, saying that we expect you to cover a comprehensive benefit. And if you're not, we're going to look at that when we review plans for rates, which they're doing very shortly. Today is the day that states have or plans have to decide whether or not they're participating in the marketplace or not. And so some states will specifically be looking for cessation coverage. And other states have released consumer alerts, and that's more consumer focused to the patients that say, if your plan's supposed to be covering a comprehensive benefit, and if it's not, please let us know, because we think they should be. Obviously, the states that have expanded Medicaid have more comprehensive coverage than states that haven't. And we're also seeing a number of Medicaid 1115 waivers, which give state Medicaid plans a lot of flexibility in what they're allowed to cover or supposed to be covering and how they implement their benefits. So, that's one way that some states are taking more action on tobacco cessation. Indiana just submitted a waiver that unfortunately has a tobacco surcharge in it, which is not necessarily evidence-based, but also does have some promotion of their cessation benefit. So there are ways that states can take action to help their smokers quit. And lastly, I want to quickly talk about promoting tobacco cessation benefits. And so why is this important? And unfortunately, there was a study a little bit over a year ago, or 18 months ago now, talking about that found utilization to be very low within the Medicaid population of tobacco cessation. Only 10% of Medicaid patients that smoked received a prescription for cessation treatment or cessation medication, which is really, really low. And recognizing how high the smoking rate is for both Medicaid and the uninsured, they both cover in around 27%. The population on private insurance, just for reference point, is about 11.1% in the most recent data that was available. So this really is a population that we believe has some high needs. Additionally, the Lung Association about a year ago released a report on promising practices and lessons learned in promoting tobacco cessation. And here are just a couple of the key takeaway points that we had. from this, and we interviewed 4 or 5 different states that had really done a lot of work on promoting their benefit. And so the first was to understand the Medicaid coverage landscape and know what you're promoting. A lot of states found that when their benefit was aligned, so even if their benefit wasn't perfect, and to definitely not wait until your benefit is perfect to start promoting it, was really important. So providers knew what they could prescribe and what the prescribing methods were. And so that was really helpful. And to really build for public health and to build key relationships with Medicaid agencies, to definitely partner at the leadership level and to develop a plan for evaluation were kind of some of the key takeaways. And we're happy to share that report, and it's on our website if anybody would like it. And then lastly is just my contact information. Please, again, feel free to, I'm happy to answer any questions now if you're in the question and answer period. And also please feel free to contact me if you've got any questions. That's my phone number and my email address. I will say that there are a lot of changes that are happening and being proposed around Medicaid specifically. But tobacco cessation is still a really important thing. And there will still be resources to help patients depending on what happens, and we really don't know what's in the Senate bill. There could be less resources than there were before, but there are still reasons to work on tobacco cessation. I think it's really important. The HUD rule is one of them, and there are a number of quality measures and other things that are also really important. So I will pause there and turn it back over to Jose for the question and answer period.
Thank you, Anne. Thank you so much. I would like to thank Marie, Simon, and Anne for these wonderful presentations. We're going to start our Q&A session. If you have any questions, please submit it through your question box on your control panel or use the hand raise icon and your line will be unmuted. And while we wait for some questions, Simon, is there any hashtag or any additional information on the 30-day smoke-free that you mentioned?
I am not seeing one right now, but I can try to track that down.
Great, thank you. Thank you so much, Simon. There is another question for you. It says, if a person is not on Facebook, is there any way for them to participate in the 30 smoke-free days?
Yes, I think that if you could go to our website, and on the slide, you can start building your quit plan. And even though it's not kind of tied into the Facebook event, you can still participate. At least by making your quit plan and hopefully through that page getting resources.
Great, thank you, Simon. Let's see. This question is for Marie. Have there been new PHAs added to the smoke-free list since the rule came into effect?
Hi, this is Marie. Yes, I'm sure there have been new PHAs added. However, we have not started to collect that information yet. We want to give the housing authorities as much time as possible to get their policies and procedures in place. We'll probably start to collect that information early next year.
Excellent. Thank you, Marie. Simon, there is another question for you. What other smoking cessation resources does CDC offer in addition to tips, to the TIPS campaign?
Well, I think that the main resource that we have is support for the National Quit Line Network, 1-800-QUIT-NOW. We provide financial support for that, both nationally and to the states. And if you're not familiar with that, anyone can call 1-800-QUIT-NOW, and that portal number will recognize where the call is coming from, and it will send that caller to the appropriate state resource. In addition to that, there are quitting resources on our website, and those links are on the handout that you can find. That will there are small T tips on and advice on how to quit, and also I would suggest. It's not a CDC resource, but it's a great resource, and that's National Cancer Institute smokefree.gov, who we partner with. And there they have many online resources, texting programs that will work with you and text advice and encouragement. And there are also smartphone apps. So those are some other resources in addition to the media campaign.
Great, thank you, Simon. And does ALA have resources showing what smoking cessation treatments are offered by a state?
Yeah, so you can find that at www.lung.org/cessation coverage. And if you've got specific questions, I can email you. We track that and we refresh it quarterly, so it'll be beginning of next month, so probably mid next month. We also submit the data to CDC's state system, so you can look there and try to have an idea of what's covered and what's not. The one thing that we don't capture is a number of states and a number of plans have additional requirements on what types of providers can write prescriptions or be reimbursed for counseling. And unfortunately, that's really a little bit too detailed to be documented. So we can give you a good overview, and then probably take a little bit more digging on your part.
Excellent. Thank you, Anne. And Marie, do you have to, let me read this question. Do you have to have a smoke-free area in your housing facility?
You do not have to create a structure for smoking at your facility. You simply cannot smoke 25 feet from the facility.
All right. And
I guess what I'm saying is you don't have to build something. That is not a requirement of the rule. While some housing authorities have found that to be prudent for their particular situation, it is not a requirement of the rule.
And there is a follow-up question. Are there any exceptions to this?
Exceptions to the rule or exceptions to building a structure?
Let's wait to. Yeah, I'm sorry. Sorry, Mary. Let's wait to see if Anne has a clarification on that particular question, because her question is, are there any exceptions to this? That's the question.
Yeah.
Are there any exceptions to? Sorry.
Oh, there we go. It says, are there any exceptions to people who do not have to comply?
No. The rule, again, the rule is not prohibiting smoking. It prohibits smoking within a unit. So there are no exceptions to the rule about smoking within a unit.
Great, thank you, Marie. That clarified the question. Now there is another question here. Probably this is for everybody. What resources are available for professionals looking to start in smoking cessation support groups?
I'll start it. Again, the rule does not require residents to stop smoking. However, we are encouraging housing authorities to work within their local communities with other nonprofit or other entities that offer cessation help for those residents who are interested in stopping who are interested in no longer smoking. So from the public housing aspect, the housing authorities, if someone's interested in working with the PHA, they should contact the executive director at the housing authority and offer their services.
This is Anne. I would add just two quick things to that. The other thing just to keep in mind, depending on kind of who you are and how you structure whatever type of counseling, group counseling or class, there is a possibility for reimbursement for that through the individual's Medicaid plan or through their private insurance plan, depending on what they're enrolled in. Additionally, the Lung Association has a number of resources, including our Freedom from Smoking class that can be taught. And so that's available as well, and I'm happy to follow up with that as well. I know there's many, many, many more as well, not just ours. So.
Yeah, and this is Simon. I would also reference people to on our website. There are partner web pages for various partners, including healthcare providers, and also for people who serve public housing residents. And while these come at you kind of from a tips perspective and what those resources are, there is just valuable resources there that would connect you to things that would be useful if you were putting together a support group like that.
Thank you, Simon. And there is a question here. It says, Freedom from Smoking class resources on what site?
The Freedom from Smoking is a Lung Association program, so it would be on the lung.org site, and please feel free to email me with if you've got additional questions. But I know Simon has a bunch of programs on some of the CDC sites as well.
Great.
Yes, that's correct.
Thank you so much. And there is another question. What resources are offered through the Quit Lines, Simon?
So the Quit Lines, as I mentioned, is a network, and so services vary by state. And I'm going to give you an overview, and Anne, if you want to chime in afterwards, feel free. So unfortunately, these resources vary a great deal, and oftentimes because of funding. So some states will have Quitline resources they might have multiple languages available. Some states might be able to provide nicotine replacement therapy for free. Some have longer hours, but most of them, if you call the Quitline, you will speak to a counselor who will help the smoker set up a quit plan. Oftentimes that may involve a callback or resources mailed out to you. Some of these programs will inquire whether or not you have resources available through your insurance. They'll ask you questions whether you're on Medicaid or if you're covered by insurance, and that may give you another set. And many of them may help you connect to a healthcare provider network in your state. And do you want to add anything?
No, I think that's a really good overview. There are a couple of states, Minnesota comes to mind. I think there's one or two others that really do try to connect, really are only for the uninsured or underinsured population. So we'll really try to connect out to the health plan or the insurance plan, depending on that. And unfortunately, some states also run out of medications if they are able to provide medications. And that's mainly going to be the NRT patch or lozenge or gum, like right. Mid-year or so.
That's right. Yeah, so I would encourage all of you, reach out to your state tobacco control program, and they'll be able to inform you about what their state quit line offers and how to best work with them.
Great. And well, thank you so much. And I don't see any additional questions here. So I would like to thank our panelists for these great presentations. To our attendees, visit our website at www.nchph.org, and you will find archive webinars, information on our training symposiums, monographs, newsletters, training manuals. And you can also join our mailing list and receive HRSA updates, Medicare updates, funding opportunities, senior programs and resources and services and information on webinars. You can also follow us on Twitter. You can subscribe to our YouTube channel. This is our contact information. As if you have any questions, please feel free to contact any of our staff members, and we will be happy to help you. So once again, thank you so much. To all attendees, please complete the post survey. This helps the National Center for Health and Public Housing to improve our webinars. And if you have any training and technical assistance needs, please contact one of our staff members. Thank you and have a great afternoon.
Thanks all.
Thank you.
Bye.
Bye-bye.
Bye.